Welcome to the clinical procedures for wrapping surgical instruments. It is important to understand how tools need to be prepared in order to make them sterile for later use. In order to prepare the tools to be inserted into what is called the autoclave machine, we must first clean the tools and wrap them in a particular way. Let's first make sure we have all the necessary tools. We will need the surgical tools, which are right here, which have been rinsed and sanitized with a disinfectant and then will be completely dried off before the wrapping procedure. This is an important step because we cannot allow moisture, excess moisture into the autoclave, and we cannot get the wrapping paper wet. So it's very important to clean with soap and water and dry completely before the wrapping procedure. We also will need autoclave paper. We have 2 layers of the autoclave paper. Now this is not the typical autoclave paper. That one is completely blue and it's a little bit thinner. This one is actually a countertop laboratory pad, and we only use this for the purposes of this presentation. However, it looks very similar and it supports the same function as a autoclave paper. So we will also need what is called a indicator. This indicator is just a little tiny strip that we include into our package before wrapping it, because this will indicate to us if the temperature from the autoclave, which is extreme heat, if it has sufficient heat inside the package, which means that our utensils or our tools have reached that particular temperature in order to become sterile. So this indicator is a good indication of that. We also need autoclave tape. This is a very special kind of tape where it has these stripes on top of them. Now they are white, as you can see. However, once they have reached a certain temperature, a high temperature from the autoclave, when we take out the product, the tape will be all black. Well, the strips will be black. And therefore, this indicates to us that the outside of the package has achieved or reached that certain temperature. Here I have just cut up strips of tape that we will be using. And so now we can proceed to wrapping our surgical tools. Now, again, as I repeat, the tools were of course used in a surgery procedure, so we can imagine there could be blood, mucus, or other bodily fluids on it. However, they have been rinsed with water and soap. However, they are not sterile yet. That is why we completely dry them, and now we put them into the autoclave machine after we have wrapped the surgical kit. So we always begin with the largest tool. For example, this one is our largest tool here. We place it in the middle, and the key is we want to begin with the tallest tool and then move our way up to the shortest. Another key thing is that we want to make sure that we are opening all of the hinges or the clamps of our tools. So if anything needs to be opened, we loosen it up, and we allow this to happen because we want the heat to penetrate all of those areas and get rid of any bacteria. So therefore we open it up and we place a cotton ball in the middle of it in order to keep it open. So we open any hinges or clamps. They are loose. We open this up and we insert a cotton ball. And we proceed as such. Again, cotton ball. We can put this underneath because it is quite large. And just very quickly stack them up, just making sure that they are all open. Perfect. So now we have our tools opened with all the hinges and clamps, and they are loose, and we place it in the middle, and we begin with our folding procedure. Now, one thing we want to make sure is that we want to make sure that it is facing straight. As such. So something that I want you to be aware of is that the first one, I prefer to be straight, and then as we proceed to the second layer, I will put that on a diagonal, which you will see soon. So again, this is all straight in the middle, and they are open. And we begin with our first folding. So the bottom portion here, we fold, and with every fold, we like to create a lip, what we call a lip. So we create this little fold, which is called the lip. Why do we do this is because as we're opening this kit, the doctor or the nurse, whomever is opening it in the surgery room, they want easy access with the lip instead of actually touching any of the utensils inside. So we make a little lip here, and then we get rid of any access. So we get rid of access. Oh, and we need to put the indicator, and don't forget about the indicator. We get rid of any access, and then we fold, and we create a lip. So again, we get rid of any access, we fold, and we create that lip. And then finally, we just fold over. Now, we don't need the package tight, just enough that it is holding it together, because we want that air to basically crawl in and creep in to make sure that the indicator has changed color and that the inside tools are sterile. So we proceed as such. And then now with the second one, we want to put it on a diagonal. Okay, so our paper is now on a diagonal. We fold again with our lip. We get rid of any access and we fold, lip. We get rid of any access, we fold, and we lip. And again, you bring the package together. With the final autoclave paper, we create that lip. Okay, so the doctor can easily uncover that. So now we have our autoclave tape that I usually prefer to have 2 strips, 1 strip at the top. And now this autoclave paper doesn't need to go all the way around, just as long as it is snug and holding the package together. And our second autoclave tape. Now, on top of this autoclave tape, what we also do is we write some important information on top of it, just with a black marker. We will write what is inside here. So we usually, at different facilities, they have different names. But for example, if this was a vaginal kit, we would just put Vag Pack. And then we would put the date and my initials or whomever has packaged the wrapping. So again, the name of what utensils or tools are inside here, the date, as well as your initials. And that is how we prepare the wrapping of surgical tools or instruments. Now this is ready to go inside the autoclave machine, and after it is done, about 30 to 45 minutes, we take it out, we allow it to dry, and then we are ready to use it in a medical procedure.